However, size doesn't always dictate symptoms.
Wait, size doesn't matter?
Size doesn't matter.
Hi everyone, welcome back to Pelvis Party. We are in season 3. We took some time off to think about the future of Pelvis Party, to think, to dream about, what might benefit our community the most. But we are back. We're in a new little location, and we are so excited for this upcoming season and the topics that we have for you. My name is Becky. I am the owner of Rochester Local, and I am sitting here with Dr. Liz Olive, urologist at Olmsted Medical Center. Dr. Olive was on the previous episode, so if you have not been able to see that, please go back and watch that episode. And today we're going to dive a little bit more into men's pelvic health. We're going to start with PSA. What is it? What does it stand for? What are some myths?
Prostate specific antigen. So this is a reproductive protein that is made by the prostate. We've touched on this before. You have your pelvic floor, bladder. Prostate sits right underneath the bladder on top of the pelvic floor, and your urethra runs through the prostate and out your penis to help you pee. So the prostate itself is the organ that makes the majority of the liquid for semen. So it serves a reproductive role, but over time, the prostate can get larger and cause peeing problems. That's called benign enlargement of the prostate, which is a non-cancer issue. But the other issue that we see with prostates is that prostate cancer can happen.
Sure.
Normally, prostate cancer is not symptomatic, meaning you can't tell you have it, you don't feel anything unless it's really, really advanced. And when it's really, really advanced, it's way harder to treat.
Sure.
So over time, we have identified that PSA, or prostate-specific antigen, is a good way to screen for prostate cancer. So PSA is normal. Everybody has some. The prostate makes it. And if it goes up or starts trending up too fast, then we worry, could there be prostate cancer present?
Okay.
There are a lot of reasons PSA can go up. It might be that you have a large normal prostate, or you have some infection or inflammation of the prostate, you're a bicyclist. Those are all things that can raise your PSA.
Okay.
But prostate cancer specifically, the cells that make PSA are more fragile in prostate cancer, and so they can leak more PSA into your blood. PSA can go up. And so that's why if I see your PSA going up fast, then they would, or if you're actually your primary care provider would usually be checking this first, and then they say, oop, elevated PSA, it's high, I don't like that, I'm going to send you to urology. And so then I help decide, do we need to talk about doing other imaging like a MRI of your prostate and or a prostate biopsy to figure that out.
Okay. So what would be some myths around this idea of PSA?
There's been a lot of back and forth in medicine that PSA screening is or is not appropriate. There was some concern, that PSA screening was leading to overdiagnosis and overtreatment of prostate cancer. And so there was a period of time several years ago where we were really drawing back. But then we unfortunately saw a rise in, the time of when we saw prostate cancer getting diagnosed, and again, therefore, it was harder to treat. And so we have been, from a urology standpoint, very much introducing the idea that PSA screening is appropriate as a shared decision-making tool. We use this quote, kind of phrase in medicine. It's basically like deciding together with the patient, is screening appropriate? The American Urological Association, which is my specialty's kind of governing body who makes guidelines and helps us understand how to practice, says that we should be getting our first PSA screening in men from age usually 45 to 50 for the average man, and for men at increased risk of prostate cancer, more around ages 40 to 45. And those men would be people, for example, with a strong family history of prostate cancer at a young age. Black men, or people who have other cancer syndromes like BRCA genes, if there's a lot of breast cancer in their family, things like that.
Interesting. What would cause an enlarged prostate? How does that happen? And what is considered normal? There's normal large, there's normal small. Where does the concern come in? Is it just PSA related, or is it size related too?
So enlarged prostate is, again, usually a benign issue where prostate cancer is usually small and doesn't cause symptoms. Enlarged prostate can be hormonally driven. It's usually genetic and a little bit of bad luck. Oftentimes, you see, my dad had a big prostate. He needed surgery for that, and I'm having a big prostate. However, size doesn't always dictate symptoms.
Wait, size doesn't matter?
Size doesn't matter. the way that your prostate is attached to your bladder and how it grew over time. Did it grow on that outside, or did it grow and pinch the urethra more? So size doesn't always dictate everything, but so, that's where we start talking about benign prostate treatments.
Okay.
With elevated PSA, if we are concerned enough about it, we have a spot on imaging we don't like, then we're talking about prostate cancer. Prostate cancer isn't something that you cause or that you did something to cause. Again, there's a genetic component, and prostate cancer is also the most commonly diagnosed cancer in men in the U.S. besides skin cancer.
Wow.
So it's very common. 1 in 8 men will get diagnosed with prostate cancer in their lifetime. Wow. It's also the second leading cause of cancer death in men.
Wow.
Behind lung cancer. So, and just to say that it's not because it's usually very lethal. Yeah. Most prostate cancer is actually pretty slow growing and things, but it just speaks to how commonly we're diagnosing this, right? And of those men, a certain number will die of it if untreated.
I see.
And so that's why for a urologist, it's very important that we're screening men for this, because we have treatments that can cure this if caught early. Yep. And the side effects of those treatments, whether it's surgery or radiation and things, are being tailored more and more over time such that the side effects are less. And so men can live post-prostate cancer more comfortably with fewer effects and cancer-free.
Wow. All right, transitioning a little bit here. If partners are noticing some things such as more frequent bathroom stops, road trips taking 2 when they should take 1, what is some advice that you would give?
I think it's really important when we're talking about intimate health things like genitourinary, meaning like peeing and sexual function and all of these things, problems, that you would hope that partners have a good open communication about these things. Or if you're noticing that you're getting irritated because you're having to stop every 15 minutes for a rest stop, these are things that oftentimes are related to the peeing problems that we talked about on the last episode. And that may be a time to say, hey, I think it's time to go see a doctor. A lot of men aren't doctoring very frequently, right? Unless they have specific medical problems. But sometimes these are the first things that will bring men into their primary care office. And again, primary care can get you rolling on some of this stuff, but ultimately, if it's really bothersome, helping facilitate the conversation about peeing problems don't have to be normal. I think a lot of men, women, we do it too, right? Like a lot of people will just this is just what happens with age. My dad had it, my uncles had it, and it doesn't have to be a struggle to pee. And so I think that if you're encouraging your partner to go get evaluated from a symptom standpoint, but also from a cancer screening standpoint, right? We should be getting our colonoscopies, we should be getting our PSA checked. Those are all things that preventive care is so much easier to deal with things and head them off early than when you've let something run too long and then it's a little too late to treat, right? Yeah. So I think that, again, sort of keying in with what you're noticing your partner doing and thinking does it have to be this way? Having that conversation together can help bring someone into the office to get that conversation started on the medical end.
Sure. Something that we like to say on Pelvis Party is never settle.
Never settle.
That really applies to your care that you receive as well as your lifestyle. Just because something has been considered normal, like frequent urination or lots of stops on a road trip, doesn't mean that you have to live your life that way. And you don't have to settle for living your life in a way that makes you uncomfortable, just like you don't have to settle for the care that you receive as well. So getting into your primary to talk about this is important for men and women in their urologic health. So I am really grateful that you have joined us on the Yellow Couch for Pelvis Party. And if you would like to know more about Dr. Liz Olive, you can watch the previous episode that we filmed together, and you can stream Pelvis Party wherever you stream your podcasts and find it on social media at Pelvis Party. Thanks so much.